Hi guys, welcome back to my channel. I have a really interesting video for you today and I am really excited to talk about this. I have not ever delved into the details of this before. I've just kind of shared that it's there. So today we're going to look a little closer at the Turner Syndrome Care Guidelines and what that actually looks like for the most updated version of it. Okay, so first I want to say where I'm finding this and what other resources there are on kind of Turner Syndrome care and the guidelines surrounding that. So I am on the Turner Syndrome Society of the United States website, which is tssus.org. I will link it down in the description and I will specifically link this page. It is the guidelines and care page and it's got amazing resources on it. It has a few different files for you. The first one is Turner Syndrome, a guide for families. It's a free booklet that is on there. It's great. It has lots of good information. Just skimming through it, it has things like what is Turner Syndrome, what causes it. So it goes over the basics, it goes over growth and development, health considerations that you need to know about, and social and emotional support and all of that. So it's really, really cool. And then you have the healthcare checklist, which is what I want to dive into probably the most. Kind of just looking at what it actually tells you to get. And then there is also a health surveillance chart, which is basically a way to track different health things that you're working on. So the one that I wanted to point out the most, because there is a whole talk I could go into about sharing this with your doctor also, but I would encourage you to read it yourself as well, and that's the patient/family version of the clinical practice guidelines. So there's a clinical practice guidelines, newly updated as of 2017, and that is directly for the clinician. You can share that with your doctor, whatever doctors you're working with, and they can have the most up-to-date recommendations and guidelines for you as the patient with Turner Syndrome. And then they have the patient and family version, which is all for you and goes over what to think about and treatments and guidelines for different things that you may run into or be looking at. And there's some different topics that look really, really interesting for just giving you some more information. So this is really, really good. It has sections on, just to give you a brief overview, diagnosis and genetics of Turner's. So this goes into how common it is, looking at that 1 out of every 2,000 to 4,000 females. And then you look at mosaic versus classic, different symptoms and characteristics. You're looking at indications for genetic testing. So these are going to be those red flags that we've talked about, whether it's hydrops, which is the fluid retention, short stature, delayed puberty, infertility, heart defects, kidney problems, so many different things all listed in that section. And then it goes into prenatal diagnosis, postnatal diagnosis, newborn screening, growth and puberty, and it goes into growth hormone treatment and hormone replacement therapy, which is when you start taking the hormone replacement medication to go through puberty. It also looks at the different variations of that. Really, really cool. And then it goes into fertility and reproduction and all of the different options with that and things to think about. So that's really great. It goes in depth into cardiovascular health issues, which is really important to stay on top of. I did not know this, but congenital or inborn heart disease occurs in up to 50% of girls and women with Turner Syndrome. That is insane. This is something that is so important to be on top of and be aware of, both for you and your doctor. And it is not an insult to share this with them. So now let's look at the checklist because I'm really excited for this. I know I'm behind on some of this, but I try to keep up on a yearly basis. So the healthcare checklist, it's loading. So these are the things that are categorized based on at diagnosis, at each visit, or at least yearly, every 3 to 5 years, or at a specific age. So I'll kind of go down each. At diagnosis, it is recommended to have a complete physical exam, have screening for learning disabilities, assess social skills and family functions, get in contact with a support group. If age appropriate, careful screening for hip dislocation, ear infections and fluids, scoliosis, skin moles, because I don't know if you guys can tell, but I actually have quite a bit of moles. That runs in my family too, but I'm sure Turner's doesn't help. And then puberty development, if age appropriate, super, super important. Hearing evaluation, yes, and I'm overdue for my yearly. Eye exam, thyroid function tests, cardiac evaluation with an echo or an MRI, and blood tests for liver and kidney function, glucose levels, fasting lipids, super, super important. All things that I have yearly, really. Besides maybe a couple of them I don't get yearly, but a lot of those I keep up with on a common basis. It does also say renal ultrasound and urine culture. I'm not actually sure what that would be for, besides just more information to make sure maybe the kidneys are working good. That I don't actually remember having. I had an ultrasound of my kidneys. I don't remember that specifically. But at least each visit or yearly. Physical exam, learning disabilities and social skills and all of that assessment. Careful screening of the ear infection, scoliosis, skin moles, and puberty development in infancy, 4 months to 5 years, 4 years until growth is complete, and childhood and onward. And counseling surrounding possibly sexuality issues and vocation/college or work plans. So then yearly, thyroid function levels begin, repeat exams at age 4, and blood tests for the liver and kidney function and fasting lipids and blood glucose begin, repeat exams at age 18. That's blood work I have every year, along with the at each visit or at least yearly is the physical exam and hearing tests and checking on my hormones and all of that. And then every 3 to 5 years, a hearing evaluation. I'm overdue for my next one. And then cardiac evaluation, beginning repeat exams at age 12. I have an echo, I feel like yearly. I have echoes a lot, but I've also had 2 cardiac MRIs. So that's a very important thing to have in your routine. And then beginning repeat exams as of age 15 for every 3 to 5 years is bone, how do you say this? Bone densitometry. I'm not saying that right. Bone density scans. Checking on your bone density and making sure that's going well, or checking on your progress if you're working on it. That is another super important thing that you want to keep on top of. Okay, next and the last category is at specific ages, and that is an eye exam at age 2, orthodontic evaluation at age 7, and blood tests for the liver and kidney function, fasting lipids, and blood glucose as recommended. Most commonly, they're just going to check all of that together with your thyroid numbers because they're already doing blood work, so why not? I feel like I do get all of those blood test type things like every time. I have my thyroid checked yearly, and they do all of those at the same time. So all of that is packaged in one neat little trip to the blood work lab. If you want to download this checklist, I will put the link down below. Go ahead and check it out. If you have not checked out the Turner Syndrome Society of the United States website before, I very much encourage you to do so. It is such a wealth of resources and knowledge and furthering your understanding, and just tools like that, like a checklist and the care guides to help you navigate life with Turner syndrome. So they also have a conference every year. I want to go. I would love to go someday. But check out this page. I think it's the healthcare guidelines and checklists page. I'll link it. I thought it would be really, really good to just take a deeper dive into what's recommended, what the current guidelines say, and all the resources out there for staying on top of your care and understanding what screenings to keep on top of. I hope this was helpful. I hope you check that link out down in the description. I will link a playlist of other videos where I've talked about the care guidelines and screenings and stuff like that, if you want to check that out for more information. If you are interested in more Turner syndrome topics, I do Turner syndrome talks all the time. I talk about it a lot. So I would love to have you hit subscribe and hang out with us. I hope this video really helped you. If it did, make sure to give it a like and leave a comment with your thoughts about the care guidelines and how you stay on top of it. And turn on notifications so you know when the next video goes live. And I will see you in those videos.